Well, we have more good news as well. And we also are running a little early, which is great because after our next speaker, you will have some time to go out and visit with all of our exhibitors and sponsors and vendors. Reminder to pick up your kids at Kids Zone at noon. Don't forget to pick up your kids at noon. And then lunch will be back across the hall at 12:15 before we start again with some very inspiring and informative sessions this afternoon. So it has been a day of, I think, excitement and great promise. And as I alluded to, we have one more exciting announcement. Joining me on stage is going to be Tobias Hagedorn. He's the husband of a PKU patient and father of 2 girls. He has been a patient advocate since 1997 when he became a board member of the German PKU Association. And he's also currently the chairman of the German PKU and secretary of the European Society for PKU and Allied Disorders. Tobias has been working with a group of us, and we're very excited to share some news with you today. Please welcome to the stage, Tobias.
Hello, everybody. How are you doing? Well, yes, I am Tobias Hagedorn, and first of all, thank you, Christine, very much for this warm welcome here in this incredible place to be. I think it's the hottest place to be for any PKUs and PKU advocates these days. Thank you very much for being here and for giving me this stage. As Christine told you, since 2001, I am the secretary of the European Society for Phenylketonuria and Allied Disorders. And since already 1997, I am a board member of the German PKU Association, which I chair since 2011. My relation to PKU is quite simple, but likely somewhat different than most of yours. I'm not a patient, I'm not a parent, I'm a husband of a PKU, and together we have 2 healthy children. So when I met my PKU in 1990, she was a sweet little 16 and she knew exactly all about PKU and all about her diet. I had to learn quickly, first of all, that from an outside perspective, living with PKU looks much easier than it really is. And I learned how blessed my wife was to be early diagnosed and having access to this nutritional therapy, which is not a given all over the world. I have a dream that one day all children will have access to newborn screening and early diagnosis and to adequate treatment. I have that dream. And I have the dream that one day science will be able to offer us a treatment with minimal impact on our daily life and quality of life. I have that dream. And finally, I have a dream that PKU patients from all over the world will stand up and call healthcare providers and politicians to listen to them and to guarantee their dignity. Ladies and gentlemen, you may have recognized I slightly changed the legendary speech of Martin Luther King, who was born right here in Atlanta. Dr. King represented a minority that was denied access to essential parts of public life, such as education or equal right. PKU patients and their relatives, you, me, we are a minority as well. We have limited access to treatment and care, even in Europe and here in the United States of America, which we Germans know as the country of unlimited opportunities. Today, even in our Western democracies, populists become more and more powerful again with 2 simple answers on 2 complex questions. But we know life is not simple, and we PKU patients and relatives know that better than most of our fellow citizens. Globally, it is 2/3 of all newborn babies that have no access to newborn screening. That means, just based on statistics, that every hour, at any place in the world, one unidentified PKU child is born. That is 700 patients every month, nearly 9,000 every year, all left to the fate of a life with severe mental retardation and physical handicap. That fate could be prevented by a simple blood test, by a simple blood spot on a piece of a filter paper. And having no access to newborn screening does not only mean to have no access to treatment and care. To deny access to newborn screening means denying equal rights and human dignity to every single patient. In most parts of Europe, in Australia, Asia, North America, in all these so-called Western democracies and developed industrial nations, healthcare systems are more or less well organized. We have educated healthcare providers, trained medical staff. We have industries that supply us with amino acid mixtures, low protein special food, and new therapy options. We have researchers who work to collect evidence on the outcome of our treatment and to identify and implement alternative treatment strategies. We have nutritionists and dietitians who help us to make our lives a little bit better every single day. Yep, there are some gaps, even important gaps, such as the insufficient reimbursement policies or the different treatment and management guidelines around the world. PKU is the same everywhere. However, strategies and access to care are significantly different even in our countries. But what we have is we have ourselves. We have patients' associations and advocacy groups like the E.S.PKU, My E.S.PKU from Europe, or NPKUA, and others, who tirelessly work to raise awareness on PKU and who tirelessly work to call for closing these gaps. However, there are regions in the world where all these achievements are not available and patients are left behind, undiagnosed, untreated, not even being aware of their hopeless situation. Still, the perspectives of a PKU patient are highly dependent on his or her birthplace, and we should not wait for the world to change it. We should take action and make it a change ourselves. Patients can make a difference. We have just heard about Liv and Doug Egeland, whose mother challenged Professor Felling to find out the reason for the retardation. Sheila Jones' mother, who challenged Professor Bickel to find the treatment for her. And Professor Guthrie, by the way, a warm welcome to his daughter, Patricia. I think she's in the room anywhere here. Professor Guthrie, he was motivated by his niece to create a tool to identify early all the few patients amongst all the newborns. These are the well-known cornerstones in the history of PKU, and all of them have been initiated by patients. Ladies and gentlemen, this week, some people from all over the world came to Atlanta to make history in PKU again. I'm proud and deeply humbled that it falls to me to publicly announce the foundation of the Global Association for Phenylketonuria as a charitable and independent patients organization. Just to quote another famous American, it's a small step for me, but a giant leap for PKU across the world. Our vision is that all people living with PKU, despite their origin, are able to reach their full potential. We will advance PKU a global health priority and strengthen PKU association and groups throughout the world. As people living with PKU, we will create a global platform for PKU advocacy that includes ensuring universal access to newborn screening, diagnosis, treatments, and a comprehensive care. We will mentor like-minded patients associations and groups and offer best practice and support that is sensitive to their experiences, to their culture, languages, and laws. And we will increase collaboration among PKU researchers, scientists, clinicians, and patient groups to move basic science forward to accelerate new knowledge, treatments, and a cure. To achieve all this is not simple. Maybe I should better say it's a real challenge and a hard job. What answer, for example, do we expect when you approach a health minister in a country with an infant mortality of more than 10% and ask him for a universal newborn screening? What answer do you expect when you ask for low-protein food in a country where people regularly suffer from hunger crisis? How should a metabolic clinic look like in a region with a poor medical infrastructure and lacking basic medical services? And how can patients in poverty afford to pay for amino acid mixtures, low-protein food, or drugs when there is no social infrastructure and health insurance available? Is it in the end ethical to call for newborn screening when no treatment is available? It requires a good assessment of the situation in every single region of the world, and we will need a lot of responsibility to make sure that the right people are asking the right questions in the right order at the right moment. And for sure, we will need people on the ground to understand the impact of religion, cultural tradition, economic backgrounds, and the political situation in each country. Ladies and gentlemen, it's time for a big thank you. I want to thank the industries for supporting the founding process of that Global Association for Phenylketonuria, which are in alphabetical order Abbott, Biomarin, Cambrook, Dr. Shah, Nutricia, and Vitaflow. We are looking forward to receive your continuing support and advice for our future work. And I ask you, please give a very... Secondly, I'd like to thank all the co-founders of the Global PKU Association. All of them are experienced and dedicated representatives of their PKU patients' associations, which are John Adams from Canada, Dennis Atakay from Turkey, Christian Bayajoria from Canada, Christine Brown from the US, Monique Cooper and Louise Healy from Australia, Jose Jesus Munoz from Mexico, Amy Oliver from the US, Ronaldo Sales Lopez from Brazil, and Alejandro Spartaro from Argentina. And finally, I want to give a very special and very warm thank you to my very best friend Eric Lunch from England, who kicked it all off when he invited some of us to a very short 30-minute meeting at the occasion of the 2016 E.S.PKU conference in Dublin. Without his foresight, we would not be here today, and without you, it would not have been possible to set up the Global Association for PKU in just 2 years. So please just stand up that everybody can see you. It was and it is a pleasure, and I think it will be a pleasure in future again, to work with all of you because you all shared your experiences without claiming to know everything or anything better than others. You are all selfless, dedicated, and focused. So, as I said, it would have been not possible without you. We have just taken a first step on a long journey to a fairer deal for all PKU patients in the world. And when it finally will be registered as a charitable incorporated organization in England, there's a lot more work ahead to establish the association as a reliable stakeholder and a partner for healthcare providers, politics, industries, and most important, patients and patients' associations around the world. We will map the global situation of PKU patients, and we will find patients groups in the remotest regions in the world and help developing their skills to advocate for themselves and for others. We will seek cooperation with international political organizations, such as the WHO and other multinational federations, to advance PKU, a global health priority. And we will initiate international cooperation with scientists, healthcare providers, patients' associations, and politicians to close the gaps in PKU care worldwide. Ladies and gentlemen, in a relay race, the slowest one always sets the pace. If we want to win the race, we have to help the weakest amongst us. The agenda is long, maybe too long to expect some quick wins or immediate results. However, the longest run always starts with the first step. So let's stop talking and start advancing our common dreams. Thank you very much, and may God bless you and the PKUs worldwide. Thanks.